doctors. Thank you so much for joining for a 2 days webinar. Our endeavor is to spread awareness about rabies, which is a fatal disease but can avoided once appropriate vaccinated. This is an initiative from Kadila through
आवाज बंद हो गई।
reduction strategy in a rabies management role of the vaccine. So, dear doctors, rabies is the inform you that rabies has
नीचे आवाज
successfully completed 1 year of launch with more than 40 k animals. To introduce you to speakers of today's webinar, Dr. Ashok Sahai sir. So we are now, sir. I would like to request Dr. Sahai sir to initiate uh, the talk, and later on we have a question and answer session. So, sir, please start.
novel 3-dose G protein vaccine, ultimate key for compliance.
Yes, sir.
Novel 3-dose G protein vaccine, ultimate key for compliance. A public health challenge in India. Globally, 59,000 human deaths annually, highest in India. India had 20,000 human deaths a year from rabies. Accounting for 60% of the rabies deaths in Asia and 35% globally. 91% deaths in India occurred in rural areas. Every 9 minutes, a person dies from rabies. Current management. Local wound treatment, first aid. Second, active immunization, that is vaccine. And third is rabies post-exposure prophylaxis. Current challenges of PP, non-compliance. Current rabies vaccine are cell culture vaccine, CCV. Inactivated vaccines are more than 50 years old technology. Inconsistency in potency, stability, availability, short supply, and adverse events. Complaint. Compliance anti-rabies vaccine, a complaint who received the full course of ARV, that is the scheduled doses of ARV on the recommended dates. Delayed complaint, who completed the but deviated from the scheduled regime. Throughput non-compliant, who had taken at least one dose of ARV after animal bite but not completed all the scheduled doses. Non-compliance to 5 dose. Proven cause of death. Original article. Compliance to post-exposure prophylaxis among animals bite patients. A hospital-based epidemiological study, Mansi Panda and Richa Kapoor at Safdarganj Hospital, New Delhi, N is equal to 360 ml by patients, a pre-designed, pre-tested, structured questionnaire was administered by the interview technique, ARV. Brief research article, compliance to anti-rabies vaccine in post-exposure prophylaxis. All municipal corporation hospitals, Bangalore, 215 animals by patient. One dose of rabies vaccine administered intramuscularly on days 0, 3, 7, 14, and 28 as PEP also measures constraints for compliance to complete course. The compliance rate for the intramuscular rabies vaccine was 60%. Constraints for compliance to complete course of anti-rabies vaccine interferes with school timing, 11%, distance of the hospital, 11%, cost incurred, 13%, forgotten dates, 18%, and loss of wages, 47%. The major constraints for compliances to complete ARV was loss of wages, that is 47%. Evolution of rabies vaccine. In nervous tissue, live attenuated vaccine, this spinal cord, inactivated vaccine, and cell culture. Inactivated vaccine, more than 2.5 IU. Non-compliance led to evolution in treatment regime from 31st dose to 5 dose and still on. Meeting the unmet medical need, introducing a novel vaccine with simple and shorter regime. Novel 3-dose of recombinant rabies G protein vaccine, first vaccine with 3-dose intramuscular regime, 0, 3, and 7 days, prepared by VLP platform technology, better compliance due to easy to flow regime and less visits. First protein subunit vaccine, convenient, ready to use, no reconstitution needed, on only 3-dose recombinant rabies G protein vaccine. G protein is difficult to stabilize. G protein isolation using VLP technology, purified and stabilized by Tedla Pharmaceutical Limited. Virus-like particles, VLPs, are protein complexes, exist as nanoparticles. They cannot replicate but can mimic the viral antigenicity without being pathogenic. They are capable of introducing a strong humoral and cellular immune response. VLPs as vaccines. Clinically study phase 3. Safety and immunogenicity of a novel 3-dose recombinant nanoparticle rabies G protein vaccine administered as simulated post-exposure immunization, a randomized comparator controlled multi-center phase 3 clinical study. Phase 3 study to evaluate immunogenicity and safety of the rabies G protein vaccine administered as a simulated post-exposure immunization in healthy volunteers. Randomized comparative controlled multi-centric study. Total subjects 800 in randomization, 2 ratio is to 1. The results were consistent across different age group and genders. Observed difference 1.52%, that is 95% CL, 0.18% to 4.17%, with the pre-specified margin of 4%. Non-inferiority for seroprotection, primary endpoint day 14 and 42 were met. Test and comparator are identical in seroprotection rate both on days 14 and 42. Study conclusion: novel 3-dose was non-inferior to reference vaccine, less adverse effects compared to reference vaccine. Novel 3-dose was found to be safe and immunogenic and was comparable to 5 doses of WHO pre-qualified vaccine. Awards: Pharma Innovation of the Year by the Economic Times and the Golden Globe Tiger Award, Malaysia, for Innovative Product of the Year. Thank you.
Hello, sir.